So all this week, we've been discussing different sleeping disorders that prevent us from getting good quality sleep. And one of those disorders is sleep apnea, and it's the most common one doctors see.
That's right. So according to the U.S. National Library of Medicine, roughly 18 million Americans have it. And I spoke with one expert on what exactly sleep apnea is and how it's treated.
Normally, we have plenty of room for the air to flow as we're breathing, in particular when we're awake. But when we're asleep, our airway has a tendency to have some collapsibility, and that's an obstruction, and they may stop breathing, or apnea, obstructive sleep apnea.
That may explain the snoring. Dr. Colon at the Sleep Disorder Center says some patients end up gasping for a breath. Other cases can be severe, even deadly. Diagnosis is important. Sometimes it calls for a patient to spend the night at the sleep center. There, they'll be attached to some leads, so technicians in the next room can detect irregular breathing patterns and monitor brain function. If they do detect sleep apnea, they might actually go in and apply a CPAP.
Through the machine generates pressure that opens up your airway and keeps it from collapsing.
So this is what a CPAP looks like these days. I'm going to put this on and have her help me out. Obviously not the most attractive thing here, but as the doctor says, do you want to breathe? Do you want to sleep? Yes, the answer is yes.
And the idea here is for this to be attached to the tube and expand the airways. Am I correct, Doctor?
Correct. It opens up the airway and allows you to breathe. Yeah. So typically we'll have a CPAP machine, and let's just say that my hands is the machine, and it's generating pressure that goes through the tube, and it allows you to breathe. It stops the snoring and really protects your heart very well too.
Yeah, we're all talking about sleeping with a CPAP. All right, well, one study reports sleep apnea is especially high in middle-aged men. Nearly half of men aged 30 to 60 suffering from the disorder. That same study also reports sleep apnea risks increase for women after menopause. So for more information on what we discuss in this week's